Hello, Raju. Hope you and your family are fine. Here in Europe, we recently had a new type of fever. It's a Eurocoup fever, very heavy here in our countries.
Wow. So this is yet another autoinflammatory disease for the researchers to work on. But meanwhile, Michael, let me narrate to you a recent story about another autoinflammatory disease. I'm sitting in this outpatient department, and two generations, the grandmother, grandfather, father, mother, walk into the office. And this 17-year-old girl is made to sit outside, and she has been recently diagnosed with CRMO.
Oh, Raju, I think you mean CNO.
Sorry, Michael. Old habits die hard. But even Shakespeare said, "What's in a name?" But I understand the correct semantics. This disease could be monofocal and often may not recur. So, therefore, CNO is certainly a more appropriate name. But back to my story. She had been recently diagnosed by us. She had had two clinical lesions and three whole body MRI lesions.
So you are also doing whole body MRI for diagnosis and for monitoring. Because previously we were doing a lot of scintigraphies, but now here in Switzerland we are doing whole body MRI. Is it the same for you?
Exactly, and we virtually stopped doing biopsies. The Bristol criteria, if you follow them carefully, you virtually do not require biopsies. And for CNO, I often just follow what Hermann Gershik and Ron Laxer write. And I remember one of Gershik's clinical pearls. Cranial bones are not involved in CNO. If you see cranial bone involvement, think of alternative causes. But back again to this case, you know that social and cultural trends vary from country to country, and in India, even by the kilometer. So this family is worried and they ask me in unison, what will be the outcome of this disease? How many cases have you treated? She will soon be marriageable. And how will we manage this social
Oh,
situation?
I fully understand their concerns. I learned that arranged marriage and matchmakers are still common in India. An Indian patient told me about a comedy series on TV about this social custom.
Yeah, true, Michael. You must watch that on your weekends. But back again to this family. For us, it may be something to smile about, but to the affected family who is still living in these times, this is a very serious concern. And one of recent of Hermann Gershik's important paper helped me to counsel the family. In this paper, what they have done is that there is a national pediatric rheumatology database of 60 plus centers from Germany and Austria, and they have enrolled patients, about 400 children, whose disease duration is less than 12 months, and they have at least one follow up in 4 years. And what they've done is that they have found that there is a significant decline in the number of clinical and radiological lesions. And this decline happened over a period of time. And not only that, the physician's global disease activity and the patient reported overall well being and childhood health assessment questionnaires all proved.
Interesting, but what about the PED-CNO scores?
Yes, Michael, they have also commented on PET-CNO scoring, but I would like you to tell our listeners about PET-CNO scoring and your experience with
So it's
using this score.
consisting of five variables: the ESR, the number of MRI defined radiological lesions, physician global assessment, and patient parent global assessment on overall well being, and the check. So it's very important to have a score to help us for following these patients. But the difficulty is to have the good items. And I'm just worrying about this score because when we treat a patient resistant to NSAIDs and then we choose a medication we'll speak about a little bit later, but we are based in our center on patients reported pain and also on involvement of the spine. And both elements are not in the PET CNO score. So I think it would be, this score is also useful for clinical research, and that's maybe the most interesting is to have a common way to follow the patients and be able to describe them in papers like in this paper, and also to score a little bit the categories of improvement at 30, 50%, 70%, like for GIA, for example. But did they report this in the paper?
Yeah. Yes. So I appreciate your thought process, Michael, that the PET CNO score is a good research tool to create a kind of a uniformity that researchers would understand, and there is clinical limitation. But yes, they did report on this in this particular study, and what they did report was that 40% of the patients following up at the end of each year with active disease reached a PET CNO of a impressive PET CNO 70 during each
This is
following
very
year.
impressive, especially since these patients were in the largely captive database and may not have the ability to switch caregivers and dilute the study. So, which were the most used second line treatments? Biphosphonates or TNF blockers?
So in Germany, they prefer bisphosphonates. I did not see too much of a mention of NSAIDs at the start, but bisphosphonates, and they talked about using pamidronate in one or two types of regime. And when bisphosphonates failed, then their next preference was to methotrexate. At our center, we are using bisphosphonates, but instead of pamidronate, our endocrinologists have sort of encouraged you to use zolendronate because it needs to be used only once in 6 months rather than
So, in
pamidronate.
our center, we use more TNF blockers. But in the literature, the efficacy of both groups of treatment seems quite similar. There's just a caution with biphosphonates because of the dental hygiene. And this is an important point we should not forget, to send the patient to the dentist before we start with this treatment.
Oh, yes, absolutely, Michael, because osteonecrosis of the jaw can be a very, very challenging situation. And that's not something that you want, and it will make you remember the old quotation that cured yesterday of my disease. I died last night of
Mhm.
my physician. So,
Did you see some in the different courses in this paper?
yes, in fact, I was just going to come to that. That with every rose there is a thorn. So there were about 5 to 7% of patients in their series who had a severe disease course. And these were patients who had disease in the pelvis, in the lower extremity, in the clavicle, and those with increased ESR or very multifocal disease at first documentation. But the authors have been quite candid in citing that some of these patients may have been enrolled late in the first year and drop out along the way. And these they cite as limitations of the
But
study.
nonetheless, it's a very interesting paper and helping us to counsel our patients on the disease. And this is an old disease because it was described in 1972 and described first by radiologists.
True, Michael. In fact, I must tell you that peculiarly, awareness of this disease amongst pediatricians or orthopedic surgeons continues to be rather low. And a large number of my references are coming from two radiologists in Mumbai who are extremely sort of well honed into this
And so, how
entity.
did your story end?
So, Michael, what I did was that over a cup of coffee, I was able to sit down with the senior generation, the parents, and give them some sort of a framework and tell them that this was a relatively benign entity and that they should remain definitely optimistic and that they should not come in the way of, whatever plans they had for their career, vocation, or marriage going forward.
Thank you very much, Raju. Goodbye.